Hello, Chin everyone. Welcome to my YouTube channel. Cellulitis is a spreading skin infection involving its inner layers. It specifically affects dermis and subcutaneous fat. It usually affects the lower leg on one side of the body. It occurs by bacteria entering through a break, a cut, a puncture wound, a sore in the skin through a recent surgical site, a skin affected by athlete's foot, dermatitis, bug bite, tattoo, piercing, injecting drugs. Other risk factors are obesity, lymphedema, history of cellulitis, eczema, psoriasis, chickenpox, shingles, having poor circulation in your arms, legs, hand or feet, diabetes. The affected area is swollen, painful, and warm to touch. The infection can cause a fever and become very serious, reaching the lymph nodes and the bloodstream. Other symptoms of cellulitis are edema, swelling, discoloration, blisters, pitted skin, fever, chills. Keep in mind that cellulitis is not contagious. It can be diagnosed by history taking, physical examination, blood culture, CBC with differential, CRP, skin test, bacterial culture. Reach out for a doc if you have a swollen rash or a rash that is changing, you have a fever, or within 24 hours if you have a swollen rash or a rash that is growing but you don't have a fever. The common bacteria with this condition are Streptococcus and Staphylococcus. The incidence of a more serious infection called methicillin-resistant Staphylococcus aureus is increasing. Complications of cellulitis are bacteremia, endocarditis, osteomyelitis, toxic shock syndrome or sepsis, gangrene, amputation, death. Necrotizing fasciitis is an example of a deep layer infection. It's an extreme emergency. Preventive tips for developing cellulitis are: wash the wound daily with soap and water. Ask your healthcare professional whether it would help to apply cream or ointment. Cover the wound with a bandage and change once daily. Don't touch or rub affected areas. Watch the signs of infection, irritation, pain, and pus. Once it develops, keep the affected part elevated. Take over the counter pain medication. Decrease physical activity. The typical treatment is use of antibiotics, usually 5 to 10 days, even after you feel better. Take loads of care and do keep all the sick patients in your prayers.